Approximately 350,000 Amish people live in North America today. Known for their rejection of modern conveniences like automobiles and electricity, the Amish are an example of a closed religious group. Social distancing guidelines implemented to reduce the spread of COVID-19 led many people to rely on technology to stay connected with their friends and family. But some closed religious communities, like the Amish, restrict their use of technology as a religious sacrament and therefore can't use it to interact with others. Since the Amish culture is organized around face-to-face interaction, we wanted to understand how the Amish are managing the pandemic and whether they comply with public health mandates. The Amish are part of a larger Anabaptist group that separated from the Catholic Church and mainstream Protestants in 16th century Europe. The Anabaptists believed there should be a clear separation of church and state. After many years of persecution, the Amish left Europe and settled in North America. The Amish today live primarily in the United States and Canada, with a few settlements in other countries. The first wave of Amish immigrants arrived in America in the mid-1700s. They settled primarily in southeastern Pennsylvania. This is part of the Lancaster County area settlement that exists today. The descendants of the first settlement moved west, starting with a string of communities across Pennsylvania, into Ohio, Indiana, Illinois, and Iowa. The first settlement in Holmes County, Ohio was in 1809. Today, the Lancaster and Holmes County area settlements are the two largest Amish settlements in the United States. The Lancaster settlement has over 40,000 people, and the Holmes County settlement has a population of almost 37,000 people. The church is central to the Amish community, and Amish generally avoid worldly things. Worldly things include products and practices like cell phones and higher education. These things threaten the church. The Amish maintain a slower pace of life, evident in their reticence to use phones and automobiles. These cultural practices set boundaries, separating the Amish from their non-Amish neighbors. These cultural practices also distinguish the Amish as a closed religious community. Amish tend to limit their interaction with outsiders, but they regularly get together with other members of their community. This draws the community together into a relationship sociologists call solidarity. The Budget newspaper provides a means for Amish to stay in touch. The newspaper was started in 1890 by John C. Miller, an Amish Mennonite who printed a news sheet for his friends as a hobby when tuberculosis prevented him from working. The news sheet quickly grew into a newspaper, covering local news and events in the Holmes County, Ohio settlement. Miller sent copies of the newspaper to friends who had moved west. His friends started writing back. Their letters provided updates about their new communities. Miller published those letters in the Budget, and the correspondence part of the newspaper grew from there. By January of 1900, the Budget was sent through 463 post offices across the United States. Today, the circulation tops 18,000 subscribers. The Budget is published every week and includes reports from over 500 scribes across the United States, Canada, and other countries. Budget scribes provide community news reports. Scribe letters follow a general pattern, reporting on the weather, news about the church, and updates on the community, including details about members' illnesses, accidents, births, and deaths. They note which families host a church on any given Sunday and report the names of visitors from outside the community. The Amish expect their members to attend church, and the Budget scribes often note when people miss services. Church services are held every other week in people's homes. The service itself is about 3 hours in length. It is followed by a noon meal and an afternoon of visiting. Essentially, church services are full-day events, often ending with a youth gathering in the evening. Amish families often visit different church districts on their off Sundays, days when their home church does not have a church service. Bi-weekly church services in members' homes draw entire communities into close physical proximity. Sociologically, these services are essential to the community's identity and its members' social solidarity. In their view, God mandates that they have church. This means they believe God expects them to gather together in face-to-face worship. We now know that these are the very settings where COVID-19 spreads. but state mandates to limit large get-togethers conflict with what the Amish believe to be God's mandate to gather in fellowship. Accordingly, many Amish don't comply. We use content analysis techniques to explore the impact of COVID-19 on cultural practices of the Amish. Mandates for social distancing isolate people in closed religious groups, because these groups limit technology and travel. We document and analyze the reported lived experiences of the Amish community during the onset of the pandemic as captured in the budget, a cornerstone literary cultural artifact of their community. Our data capture the importance of in-person services for the Amish. At the beginning of the pandemic, in March and April of 2020, 97% of the Amish communities reported holding at least one in-person church service. The majority of reports also indicated that these services were attended by visitors, some of whom came from other Amish districts whose churches had stopped holding services because of the pandemic. Some communities did try to alter their services, such as canceling the meal, prohibiting after-service youth singings, and spreading out the congregants. Many tried to limit social contact, specifically by not shaking hands or greeting each other with the traditional holy kiss. We can see an example of this from a church district in the Holmes County, Ohio settlement. The congregation canceled the lunch and avoided shaking hands, but still, many people were there, some from other communities. We do see evidence of caution among some church members. While churches still held services, not everyone attended. Some elderly members stayed home, as did some mothers and children. This is unusual behavior for the Amish, who consistently attend church services in normal times. Amish churches that met in person tried a variety of social distancing strategies, ranging from requiring that members of the same household sit together to dividing the congregation into smaller groups. We see an example of this in a congregation in Holmes County, Ohio. The group gathered in a large building and used social distancing guidelines to arrange their seating. About 60% of the Amish communities canceled services at least once during the initial months of the pandemic. Of those who canceled, 90% did not offer alternative services. The impact of not having church services goes beyond Sunday worship, as most people rely on the Sunday meeting to connect with their fellow community members. Several scribes mentioned how they missed the fellowship from church. While some churches canceled services in the first few months of the pandemic, based on the advice of local health departments, most of these churches resumed services a few weeks later when the restrictions were lifted. The Center for Disease Control identified religious communities as a vector for COVID spread and called for research to better understand these communities. Our study is one of the first to examine how the COVID pandemic and social distancing policies affected closed religious communities, particularly those whose religious beliefs and values restrict technology. The data used in the study provide an unparalleled lens into the lives of the Amish during the COVID-19 pandemic as they narrate their experience to other members. This project, supported by the WVU Humanities Center, provides preliminary data for our larger project on the prevalence of COVID-related health misinformation and social distancing or isolation practices within closed religious communities. That project is funded by the National Science Foundation, which examines how cultural boundaries and community network ties spread health misinformation and reduce the prevalence of social distancing or isolation. The findings will provide vital information on factors driving COVID-19 within closed religious communities, informing future health interventions within these communities.